Hello, my name is Lisa. I'm with Golden Search and Rescue, and I'm here with Mountain Sledder today to talk about broken ribs in the backcountry. We'll talk about broken ribs because it's a high possibility of happening in a situation of sudden deceleration, flying into your handlebars or a tree, or in a sled rollover situation. So initially, you'll want to do an overall assessment of your patient. Check and make sure that you're not getting distracted by the rib injury from something else that might be going on. Check that they haven't hit their head, they don't have any neck or back pain, and check their ABCs. Their airway, their breathing, and their circulation. Make sure that all of those are intact and effective. When you go to expose and examine the injury site, you want to remove or lift up the clothing so you can examine both sides of the chest. You're going to get your patient to take in a deep breath. Find out if that's easy for them to do. You're watching for both sides to rise at the same time and the same amount. You're going to look for any deformities, any bruising, any bones poking through the skin. Even on the same side of the chest, you want to look for if the same bone is broken in multiple places, that part of the chest won't rise and fall exactly the same. You'll be able to see a difference in movement. If you see that scenario, that is an emergency. You need to call for outside help. If your patient is having difficulty breathing and the sides of the chest aren't rising and falling equally, that's an emergency situation. You need to call for help now. You can feel around, feel for spots that are unstable, listen and feel for broken bones. You can hear or feel them rubbing together. There's not a lot that you can do for this patient in the field. They need to go to a hospital. And like we've mentioned, a broken rib can involve a punctured lung, and that can be really serious really quickly. So our priorities here are quick transport, keeping the patient warm, and monitoring their ABCs, their airway, breathing, and circulation. Anytime their breathing starts getting too rapid, really shallow, or it looks like it takes a lot of effort for them to breathe, we're getting into an emergency situation and you need to get help now. So depending where you are, if you're close to the parking lot, you can sled out quickly, or you can call for search and rescue. If the person's capable to, you can get them to sled out on their own, or you can double them. Or again, with the correct communication tools, you can call search and rescue. With the priority for rib or chest injuries being quick transport, a couple other things you want to think about are being gentle with the patient, not causing more damage by moving around roughly. Monitoring the breathing. If it gets difficult, worse, or absent, you need to get outside help now. And the best thing that you can do for your patient in the field is just to keep them warm. A couple things you can carry with you to help keep someone warm in case of an emergency are extra jackets, extra toques, extra gloves, a little emergency blanket. This here is a pretty compact emergency sleeping bag, or you can carry a small tarp with you. Other than that, there's not a lot you can do to help broken ribs in the field. The key things to remember with broken ribs are quick, gentle transport, keep them warm, and monitor them closely to check for complications with breathing. Any issues breathing turns into an emergency situation.